The former president, I wish he never said this. I wish he never said this.
Agenda 111 must be continued. Continuity, not disruption, is how health systems succeed.
He told all of us that Agenda 111 will be completed before he leaves office. Let me even grant him the longer period he gave, that he will complete all Agenda 111, all the 111 hospitals before he leaves office. And by the time he left office, he had expended 4.8 billion Ghana cedis on Agenda 111, and not a single one of them was in operation. So this is the person calling us to complete Agenda 111.
2026 budget.
Yes, Agenda 111 be will be na me ya domo Ghana sika dia shame no you better say e be put it to good use.
New one and the health minister on the national health insurance boss Dr. Victor Asare Bampoe Ediabano say Ghana alanche free primary healthcare policy.
Here we are saying that it's going to be free because we realize that almost about 80% of healthcare needs are at the primary level. Okay? And if you have financial barriers at the primary level, then people find it difficult entering into the healthcare system.
Health Minister Kwabena Mintah Akandoh, what the revelation be about Miema Shemise womb. Or say Nanado Dankwa Akufo Addo spending 4.8 billion Ghana cedis on Agenda 111. Yet, hospital no bago kra ni wa yewie. Na say yebetima complete Agenda 111. Nanado Dankwa Akufo Addo, the former president, start here, you be here 20 billion Ghana cedis.
The former president, I wish he never said this. I wish he never said this. Unfortunately, he has said it. He told all of us that Agenda 111 will be completed before he leaves office. Let me even grant him the longer period he gave, that he will complete all Agenda 111, all the 111 hospitals before he leaves office. And by the time he left office, he had expended 4.8 billion Ghana cedis on Agenda 111, and not a single one of them was in operation.
Not every project was completed. Some facilities reached advanced stages, but could not be finished before our term ended. Agenda 111 must be continued. Continuity, not disruption, is how health systems succeed. What was built must be maintained. What was started must be completed. What was learned must not be lost. That is how progress is ensured.
So this is the person calling us to complete Agenda 111. But let me tell you the good news. His Excellency the President has instructed that no project that he has inherited should be left to rot, should be left unattended to. So Agenda 111, we will continue Agenda 111 and we will finish Agenda 111. We will put every peso invested in this project to good use. So if you read the 2026 budget, it was clearly stated in it that this year we are going to finish about 10. And we may even finish more, I can assure you. And this time we are planning to see how we are not behaving like they behaved. We are planning. So we'll look for the source of funding. Even if they had planned, the 4.8 billion could have completed about 20 and roll out the next one. So now we are planning to see where government can come in to finish. Where CHAG, the Tayeboa is here, the Christian Health Association of Ghana, they are our partners. We are not into competition with them. Can you also come in to pick some of them, finish, equip, and run? The private sector, where do you come in? So we are planning a lot of thoughts going into this. Please.
Adena Ghana moyesa. You spending 4.8 billion Ghana cedis. Yet hospitals ye pebi yenya. Why? Boni ben ya na we na the health minister Kwabena Mintah Akandoh say or wish said nanado okojina achebi na omu kamba hospital na oga say NHIA or wish request said na John Dramani Mahama and complete agenda 111 or wish NHIA nanka wanka because untimi spending 4.8 billion on 111 hospitals yet pebia de kwa anya ba kukura complete. I remember say logo na agenda 111 logo no kwa is spending 400 million Ghana cedis so mo de munni esika sa why munni esika sa ugo Prim was some of the small villages and our towns are the way omo brave hospital ho no you be thinking say Ghana no omo kan bi se si ameni u kasei ugo Prim your friend is saying mepe agopo seden I think say Otongu district amount for trap quite tin ansana omonya a healthcare omo Ghana how omo to abo omo twa either direct or indirect taxes but to get assessment to get an access rather for so ubenya access to healthcare a problem now here ba ku bia mi hu yi kwanu wanti na esi akuafo bi a Addo na eje na wo na kire na obi we boy now you spend 4.8 billion Ghana cedis near to man complete hospital ba akra. So doesn't mean na Addo angasa oka asase na na me say mistake. You or the last person that so buza about agenda 111. Logo agenda 111 logo no. Logo no nko ano 400 million. Logo na me here 3 days krampo na me grandma design bi no. Chese sikadie basa sa left right center ana mudi ya na mokoye ndie na ye ka kire me no mienu se se ebetima complete agenda 111 na here 20 billion one bottom me no mienu ye tax ana loans a me no mienu ana ye baba ye aduma am ya jeje more tax e de atwa ko president bienu wo oba o yin bottom sika ana di save Ghana e me no mienu asika oh nema bi abufu country mu sa o marry mu no nema bi abufu too much but me dey aye tribal ye dey aye politics ye dey aye religious practice na ya wie na ya pon na amanfo wu because of the greediness of some few people. Now according to the health minister John Dramani Mahama in his budget for 2026 on at forcing the finance minister allocated a budget at the 10 agenda 111 hospitals or better at the end of the year or multi start a complete and no hospitals are adru 85%. Now I know ye be and send a pay home equipment and send copy nurse for mo be aduma wom according to health minister say my calculation ye pa a bit much about best 65%. At the end I say 85%, you know. So all the equipment you can't want and the best 65% and you complete. But John Dramani Mahama say obey back 10.
Agenda 111
do say
Nyamia Daroma so share 2026 budget anymore. Buying a share say anymu be 10
2026 budget.
Yes, Ashim. In charge na 111 be will be no. Na me ya domo Ghana sika dia shame no you better say e be put you to good use. We have about 3 options. You will be more why quite a high number abayan kasa de sika be shame near wie. But what I say that's the first option. ye binom ho a ye corporate Ghana ene sorry ebi ti say Chag Amedi Kaka and Christian Health Association of Ghana ye no mo sa ngita hudie no te bi ho a so Catholic for mo hospitals bebre e wo man nim nti ba ko bi esi dwaboso de no betimi awie na matoa so eno shede be ma omo aban nje omo kapre sorry no mu di saa ye fa doctor for ma omo ye fa nurses for ma omo aban na ye bibia ide ma omo nti omo no enye profit oriented hospitals je no omo be saa. The third option also the pure private sector. Ebinum ho a bi wo kra 10% 20% completion nti se wo hui na se wo ska na fi se obetimi dia hyem na wawie na oni aban akonhyehye ebi a bed operate and transfer and now say subject to renewal about 10 or 15 years na bi ada na ma aban a san hyehye nyina they are all on the table and no be boa yen ama yetumi awie a high number of them than say you be German pro President John Mahama ahye say project bia na ban ba ye oban inherit ye no ba kokura ni ho be abandon
in 2026 ye wo I think said the fourth month money away.
Yes.
Enti ya approve budget na said this year anye bia be 10 e wo se ye. Ebi wo ho no mo contract bi wo ho ye adwuma sabri ye kasa.
Yes. Some of them. With for example on Friday or so many contractors in the NHIA or more money site, and I encourage them to go back to site and I'll hit the road very soon to go for inspection.
He found the NHIA contractors in the also.
Oh, especially more at above civil works. There were about if I say 85% and above, we've asked them to go back to the site. So
and maybe you want my
no back when we are no yes a year the 80% and maybe or say we can say oh yeah total like 65 or 70% because of the equipment aspect. But they make an what say hospital no any brick and mortar no facilities now or any equipment so can home into we civil works and cramp no I will say install equipment in here into back anywhere to see America say. And if you need more information about you know now about 4.8 billion Ghana cedis has been expended on Agenda 111 and if you per se
and you know must
oh be yeko commission ye dem pa kosim ba equipment bi ani ho hospital nyam pane brick and mortar e bi won so a equipment ba ko mienu bi esi ba bi ani ho a sabi ye ba afofro na miensa bi ho a eye debatable ni ameko ho nyina ba ko kra no ye wi but that is not the bone of contention. That is not my ayikra. What I'm saying is that ye be wi kwan bi e fa so a ye be wi we are planning ye de hye egu ho. Yes, yes, so money, yes, ye bibia basa there be ye be planning. Nya hwede betimi di ensa som. So 4.8 billion no. And ye planning year, can no kwan betimi be 20. No one say ye 100 and net there be no answer be any. What we are going to do is that we are going to plan. Near who say, oh, a buying a betimi discuss say and ashim. Inti we no yenye we nti ensam free home. Na we nsu yemfa man krankra we nsu say ne be ya because ye ka say ye pebe 20 billion Ghana cedis de ko wi agenda 111. Ebia be 10 years kan nya sa 20 billion no. Because don't forget say the health sector is one out of the many ministries we have and we have a country to govern. And ya dia Ghana sika nyina I agree, and the health sector is for me is the most important sector of the country. It has direct correlation or reflection on productivity of the country. But then mumun so no I was say who say ye to me for my sika nyina enko ye we nti I was see a plan and who say okay nya de betimi nya 20 billion Ghana cedis e de awie dia e kwan be ne betimi adwen yie ni ahye ya ye nhye eno so no betimi aboa yam ya awie. That's exactly what we are doing.
Now this is what I was saying and I've been saying all the time. The first COVID buy na ye who say na ye lack hospitals enough hospital space I be accommodate say ye mass diseases na say viruses affect a man for you need enough hospitals. And no na do koye some mistake because say oh maybe 111 hospitals. But the question is, was it just a political motivation Anasine eye menu mienu ya dwene ho say e be say nya healthcare enti na ye sa. That was the time when the national health insurance for ka. Ni ntimi ntwia ugodu health insurance your friend say hospital now the health insurance ka. Aduro bi e be so ama no. What me say yare aduro ndo be no ba yare ne nko. Biko para awie yapon ya ka bia no ne a directive to pharmacy koto. And we felt say building 111 hospitals at the same time was something monumental. Yeah, but yesterday because some years ago, your president BOC 101 hospital, 111 hospitals. Look, you inform political message, you know, our life. Yehu, I'm a man for wish condolences. Yehu na man for rest in peace. Nyame de ba ale ka o yempe. Mumwa ye ne ho ntoye. Ye ni your hospitals are any best. And we thought say doing something that's unachievable. Oh, see 111 hospitals. Meanwhile, your certain regions, our hospital on the NHIA upgrade. At that same time, is 111 hospitals no. Now, who go pay more comfort emergency units. And so two for the people. Nya fix it. Fix it no more. Other small towns are your cheap compounds no upgrade. More be fitting hospitals. And can you say yeah, that which see even 10 and not 20 hospitals plan. And can you enough? And at least one save a month for life. Now 111 structures without completion. For so ben also. And for so ben pan yenya. Na Ghana na okaka bibia na manfo asio ma no e dey politics. Miwa minu mi enuta sika e na eyisu. O me mre why? Say bre no ya Akandoh. Now another good news eba after the bad news am explaining. Because 4.8 billion near complete one hospital and they here 20 billion. Near complete all those hospitals. Now they say I know they a very very terrible news. But good news now, my brother Renunier. When you say John Dramani Mahama, Alante, dear friend of Mahama K. Because the saying the tuncha, you may hear Mahama K. And they are saving when it comes to kidney, liver, cancer, any other deadly disease, and as deadly sickness. Say about na say wo Ghana for 95% enya ye bubro. Enya ade e betima afford it. The number of times a man for Adiako TV so radio so aso for ama yesre the public say any donation. And for more amount obi for kidney problem, obi for liver problem, obi for cancer problem no. Enya sem getwa. The number of times a philanthropist move to say Ibrahim Mahama mo Sulali Muntari mu eyi sika twa amount for friend say kidney no liver nas problem bi e kan no enya sem getwa. Eti Mahama care aba. But NHIA, the new one, and the health minister, on it, the national health insurance boss, Dr. Victor Asare Bampoe, Eddie Abano said, Ghana alanche free primary healthcare policy. As our free healthcare primary policy, we know. The Eba say, a teaching bench, moi, baby, I'm one about clinics, hospitals are. In fact, when we
talk about the free primary healthcare policy, what exactly is it? Okay. In fact, if you need to break it down for us to understand, what would you say it is?
So let's start with the primary healthcare. So primary healthcare is healthcare at the first port of contact or first port of call for Ghanaians or for people everywhere and anywhere. It's at that level that you get your basic healthcare, and countries define what they mean by the primary healthcare. So there's a basic minimum care package. Here we are saying that it's going to be free because we realize that almost about 80% of healthcare needs are at the primary level. Okay, and if you have financial barriers at the primary level, then people find it difficult entering into the healthcare system. The National Health Insurance Scheme is there, but remember that last year, or in 2024, there were only 57% of Ghanaians who were on. Last year, we pushed it to 66%. But it means that there's still 34% who are not on. You know, so if you make the entry level free, then they're able to access and then hopefully be encouraged to get the card, so that if the free primary healthcare is not able to take care of the problems that they have, they are referred to the next level. If there are challenges there, then they are referred to the Mahama Cares level, which is looking at the non-communicable disease. But the most important and the most exciting thing about it is that there is prevention and promotion now. Normally, when we talk about healthcare, we look at the curative aspect. So we are reactive. You get ill, and then you go to the hospital. But many of these diseases, especially now in Ghana, where because of what we call the epidemiological transition, we have what we call a double whammy. So we are suffering from the communicable diseases like malaria and so on. But because of lifestyle changes and so on, we're also getting the cancers, the strokes, the mental health conditions. So we have these two.
Right.
But for these non-communicable diseases, a lot of the time they start slowly and silently. And we only pick them up when they become a problem and very complex and, you know, to deal with. With prevention and promotion, if we are able to catch them early, we're turning off the tap so that fewer of them will then progress to the end. So eventually, it's also a sustainability mechanism, because eventually fewer people will be progressing to more complex diseases that have to be managed. So that's why it's exciting, because we're doing this end-to-end health coverage, but we're doing it in such a way that we're trying to turn off the tap. That's the preventive side. The promotive is also that now people are going and they will be told about the things they can do so that they do not run into problems in future. So it's, I think, a very beautiful package for Ghanaians.
Eti sa free primary healthcare na riba no ade a ebeboa mo a hospitals chip compounds clinics belong to the government. Ni na no yese ho na mo first point of call. Say yare ne ba baby amuni kan ko no na se emu yadi a yare fam to different place. According to the friends, the chief executive officer Edema National Health Insurance Authority, actually say Ghana for the donor still either says scan no munya you say health insurance na enya attractive and for move bebre na mpe Ghana your population ni na no 62% of the population of Ghana about 36 million no anna e health insurance card ya kan na ye ni bi, but sa free primary health care no ebebo ama wo bio uni bio watimi anya yaresa ebehwe ama ho ato na se mu yadin a wo ko wanim no na ye introduce health insurance no so e de kan o say o believe say the more ye we no ebema amanfo nya interest so menya health insurance and Ghana health insurance a car na omode no John Dramani Mahama na health minister Kwabena Mintah Akandoh omakle e de free ho. 2 Mahama Care ono John Dramani Mahama, His Excellency the President, ono ano e di 6 months salary e di kotu mu, the vice Jenano Poku Ajimai e di 3 months salary e kotu mu, o share ni appointees ni na se obia 1 month ne de ene mo ne mo yerem goda kom obia fa betu Mahama Care ni mu ana enu achi MPs anase a friend say ministers are not more stubborn proud omo declare omo asset ana mo be so omo declare no punishment e buy say obia so 1 month ebeka ho ntina omo de na kwa 2 months, because every appointee be atwa 1 month plus wa waso ye de na wan declare asset another extra 1 month ebeka 2 months ye bie kwan ama friends say business owners are more sika eso donation editum ansa na government no ono angasa as a country yangasa is free futum ede ko kan ho edini na no beboa ama yare a esombro so na yesika nso ebetima hwe na guess what Samia Uku MPP ni mapa papa ne se Mahama Care oba 2029 MPP ana oka ho asemi ome cancel adanya duplication of national health insurance na Mahama Care ene national health insurance difference be the woman. I'm trying to reason with you. Why? Me boom fun ne na obi abeka say mazi de bia de wadwan krofo de bi na me bumfu ndi me no me na no let's reason with Samia Uku. Is it the same thing and that's a difference wo national health insurance juma na ye ne say yare nkete and ehwe and me no me know how politics is run me no me nim MPP ko eja kato ho eno nya me problem but there's Samia Uku can say ebia na ebit my extend say national health insurance no you make sure say ene ebe cover yare bit say kidney liver cancer now instead of say you create a new a friend saying healthcare policy no you expand the order than but knowing very well how our national health insurance NDC time yehuka MPP time yehuka sa kan ba hospitals timidwa eno sa bufo na hye omumu anne even ye twa omuka wiempo a they don't treat you better open a hospital with that national health insurance card kwanya first treat you different now hospital with national health insurance card yehu omuhu ye no mboafu ubaka so ya mbone government sutia die aduro bi ye administer dia ma obia no ye twere de to ho ebi okura omu inflate said that they are getting more in every government in change. Yet, when they see you the health insurance, they get angry. Yes, I'm for kidney liver problem. And what's angry for is that is where Samia Oku. And what they uchu mu time. You know, enya you know. And yet, me assure some about say free primary health care now mo dey about no say twem. Because me tell say no so you go health insurance for answer. We a health insurance for so by a different name. You say national health insurance in Ukta Kada. It is believed that all hospitals for free. You're here for free. Not government. It fears I cannot. But yet, we are still launching free primary health care. And the current CEO, Edema National Health Insurance, is actually say, just 62% of Ghanaians are registered. And the truth is, even the 62%, a bit year will renew here. Our money money to renew. Because when they look at the services, our Monsaka, somewhere are there, and shame crime. So let's stop the pretending. To say the national health insurance scheme, no, omo ye adwuma so nko bia ma hospitals na collaborate am na it is a Ghana for what to ye. No. And obia nim say John Dramani Mahama buy when it comes to health, the man have been very friend say serious about it. Now you are occupying of France, when Emmanuel Macron, France for president. As in the One Health Summit, Eko Oyeko chair, Oko UN, or speaking about vaccines. Say friends, the USA withdraw almost funding on WHO. Now the entire Africa, polio, need the Indian vaccine now and you were creating Accra Research Secretariat. Already talking about friends saying health. Say Africa 4 countries need an boom. They are creating vaccines. And then when you say your original medical stores all over Ghana. 16 regions in the original medical store. The man care more about health. He care more about the well-being of Ghanaians. And one thing I like about that free primary health care, no, the two things. Bako say oyare. Bako mienu say ye de boa ama what prevent it say yare nkwa beba. And I've been talking about that because I don't get it. Why Ghana? The only time we are active, ade atamna to ye. But to ye no. Ye ntime nwene nkwa anim ka say ye to so aye we a we be si. And for that, ye ni kan boy ho ban free we hu. And also happen. But according to Samia Oku na e kana asem. 2029 minim one ka say MPP kra ba. O say MPP ba o metwam. Na de okay. Say obi go enjoy say free primary health care yi. Obi go enjoy Mahama care yi. Na o ka chen say over 2029 obi twam a. Na wagimi enti wasa so akwa salai akoto aba mo sebra. Munya say MPP no mo ankasa mu di kan vote atiam ho. Ansa na mo be 2029 election no. 2020 election. The mu yi. Emma obi motivation na mo short memory wo. Okay, say ye di kan ka kire Akufo kan bi Mahama su ka bi. See short memory. Ebi ayi mu na ayi na na short memory no. Because the kind of government murani ko etu we honom no. Me say it will take NDC to do worst for NDC to lose power in 2028. At the end no hosa no. Any more propaganda bi amoya sometimes em for kwamu no. Ese be che. Well, mudi wa na ko 2032. Ebedo na ya ha NDC won for ne. But the muye enkomo bi amudi kire ye no. Se bi ebi a time pa. Why? Ebi a time. But me ka kire wo odofo a wo hwe me nne. O man Ghana no. O former president Nana Akufo Addo spending 4.8 billion. Say no or the year agenda 111 111 hospitals. But yantiman complete ba kra. And then the health minister Kwabena Mintah Akandoh catch me say we will need 20 billion as in a complete. For that reason, yeah, the hospitals need be friends missionary friends hospitals for no. Roman Catholic hospitals, Presby Hospital, Methodist Hospital. Ebiso we are private one and there mo abroche no kakra wo mo a opportunity ni mo be invest. We betuma beje a hospital. Now I private friends public partnership. Now sa partnership no o ma calculate the number of years. I say be operating hospital no. Eduru award na over e dey Ghana. But sa hospital be hospital what 10%, 15%, 20% enhyere nko nanim sa wo abesi na government no emwa na uwie a wo de aye adwuma te woka wie na aban no asa befa na de aka no so ye de kwakoma afren sen asore fo na omo asore hospitals no monye na mokra mo rane a mo de ne better chen Ghana for say political leaders na nga say you omo nkrofo level will be edru new. But Nanado Akufo Addo, the former president, Asare John Mahama said on complete agenda 111. Scout said in 4.8 billion. 1 year back. Nanka make sense. Say a basic be 20 hospitals without 4.8 billion. They are complete. Now say basic 111. Me pacho boame. Na make sense na. And remember the good news. John Dramani Mahama, the joy giver, and he said Ghana alanchi free primary health care. Ne omo won kra se achichiri benche mu ni na bo abenya ayaresa for free. Oh, nya news bi se a oda weti mada. For comments to comment section na se subscribe, like na share ma unya enya bi enhwe. Edi no e ba ko pe max billion I will naked truth o Boga Trends Macau. Bye bye.